You're watching Fox 45 Morning News. All local, all morning.
Don, thank you. Binge eating disorders are a major health concern, especially around the holidays coming up. Some of the symptoms of the disorder and ways you can help yourself or others. 7:17 is there for you this day. We'll turn to some health information this morning. Besides weight gain, there are actually some serious health concerns linked to binge eating. We are especially at risk, as you might imagine, during the holidays. Dr. Abhinav Sankineni, did I get it right?
You got it.
Okay. Gastroenterologist with MedStar Franklin Square Medical Center. So thank you for being here, first of all.
My pleasure.
We were kind of being glib about it, that it's a little funny to be talking about this right around the holidays, and yet that really is the right time because folks may be more aware that they're eating more than they should be. So how do you know that you've moved from overdoing it at Thanksgiving into a full-fledged binge eating disorder?
So especially if you start, noticing a couple of pounds around your belly, and then also you start feeling some discomfort in your belly or burning in your chest. That means you've gone beyond binge eating and weight gain. So you're getting the side effects of the weight gain, such as acid reflux and heartburn. Okay,
so those would be some of the early symptoms. That's can be associated with just maybe one too many meals, but are you talking about more of a chronic situation where this is something you're feeling all the time?
Yes. So usually if you see this GI or stomach problems over a period of time, probably patients, they notice that they've been having discomfort when they're eating large meals. And they start having burning in their chest, trouble swallowing, acid taste, and burning, so forth. So that's when you know that, you moved beyond binge eating, regular holiday binge eating, and you have some problem.
Yeah, you've done some damage, too. Yeah. What is the long-term prognosis of something like and I know the GERD is a common acronym that gets thrown around, and I've heard that lately. What are some of the long-term health effects from having those diseases?
So acid reflux is basically the acid backing up from the stomach into your food pipe. Now this acid over a long period of time can damage the lining of the food pipe, resulting in damage, and patients have trouble swallowing. It hurts when they eat. It also it produces so much acid that over a long period of time you can get some precancer changes.
Oh wow!
Especially if it's alarming, if patients have trouble swallowing, if they're start losing weight when they're not expecting to lose weight. That's when you're in real trouble and you need to see a doctor.
And are there treatments that are available for someone who's gotten that far down the path?
So first of all, when patients initially they start getting stomach discomfort or burning in the chest, there are a couple of things they can do to help themselves. If they can lose weight, that's great. Also, instead of eating 2 to 3 big meals, if they can do frequent small meals, will be very helpful. Try to avoid foods that cause those symptoms: coffee, chocolate, peppermint, drinking, smoking. These are all things that you can avoid. And also, if you start noticing burning in your throat, especially at the night, make sure you keep the head of the bed elevated. However, if these symptoms keep on happening, this is the time to see a doctor because you need medications to control it. And sometimes you need further testing to see if you don't have enough damage in your food pipe.
Right. I'd imagine there's certainly a mental health component to this as well when you see these patients who are in the midst of a binge eating disorder too.
Yes.
So holistic approach that you take.
Totally.
Excellent. Thank you so much for being here this morning.
No problem. My pleasure.
Hopefully that helps someone at home who may be thinking of themselves or a loved one. We appreciate it.
Thank you.
Coming up, some